I'm Paul Allen, Chief Executive of the Royal Hospital for Neuro-disability. Now, normally at this time of year, we would be holding a thank you evening to thank all our supporters, and I would be talking to you in person. Well, of course, because of the restrictions with COVID, we aren't able to hold an in-person thank you evening this year. So instead, this is a video message, but again, absolutely to thank everybody who's given us so much support during the last year. Now, the Royal Hospital for Neuro-disability looks after some of the most severely disabled and vulnerable patients. Most of our patients are here because at some point they have had a brain injury, and many actually make the hospital their home and live here for many, many years. We don't actually refer to them as patients, we refer to them as residents because it is their home. We have approximately 220 patients and residents. The hospital has been here since 1853, so it has a long and proud history, and we continue in the modern era to focus much attention on providing the best possible care for our residents and patients. And we can only do that with the help of people such as yourselves. And that's particularly applied this year because, of course, this year, as with the whole country and indeed the whole world, we have been faced with the challenge of dealing with the COVID crisis. Here we are in October, when the COVID lockdown started in early March. That seems a long time ago now in many ways. In other ways, it seems only like yesterday. But when the crisis arrived, we actually locked down the hospital about 2 weeks before the national lockdown. Amongst other things, that meant that visitors weren't able to come and visit their loved ones, which was clearly a very challenging and disappointing situation for relatives, but very necessary in order to protect the patients and the staff from infection. Now, as with the rest of the country, we did suffer from people having infections in the early period during March and April. But I'm delighted to be able to say that since late April, we have had no new infections. So at this time of speaking, we've gone for something like 170 days without any new infection. And I think that's a great testimony to our staff, particularly, of course, those working on the front line and those supporting them with all the infection control procedures that we have in place. At the moment, there is, of course, the probability of a second wave, which is building up in the country at large, but we will do all we can to try and prevent further infection from coming into the hospital. Now, there are so many ways in which those of you watching this video have supported us. And in a moment, I'm going to go through some of the detail of how we have been supported. But overall, a real warm and sincere thank you to all of you who have supported the hospital, particularly during this difficult period. In giving thanks, I would like to start by thanking our President, Lady Leonora, Countess of Lichfield, for the enormous support that she has given us both this year and indeed over a period of time. And in fact, in recognition of her support of us as our President, we made the decision early this year to rename one of our wards, one that we've just completed the refurbishment of, the ward that used to be known as Andrew Reed Ward, but is now going to be known going forward as Leonora Ward. So thank you so much to Lady Leonora for your support. The next thing I'm going to give thanks for is the work that various groups in the community have carried out, both to produce face masks, face shields for us, and what we call scrubs. Well, I'll start with scrubs. What are scrubs? Well, it's what I'm wearing now. So many of our clinical staff have uniforms to wear, but one of the infection control procedures we introduced was that if you are not a member of clinical staff with a uniform, but you still need to go on a ward, you have to wear scrubs, which can be the sort of thing you might have seen on TV, people using in operating theatres and that sort of thing. But for us, in many cases, it has meant homemade scrubs and I'm wearing a generously donated set of homemade scrubs at the moment. And these have been sewn by various community groups in support of us, including the group known as For the Love of Scrubs, Mask Enchanted, who worked on masks for us, and Holy Trinity Church. I know that volunteers in these groups have spent hours preparing these scrubs for us. We are so grateful, and indeed they're very comfortable to wear, so thank you very much indeed. I'd also like to thank for donating to us face shields, Cameron Design House and St Bede's School. The next thanks goes to those who have helped provide transport to enable our staff to get to and from work as safely as possible. I think everybody knows that in the outside world, travelling on public transport is one of the challenges during COVID. And so thank you very much to Wandsworth Community Transport and Bell's Buses providing transport services, and in particular a bus, so that we've been able to run our own transport service to and from Clapham Junction Station to the hospital to help our staff get to and from work. Now, during a crisis such as the COVID crisis, which of course involved complete lockdown of the hospital for a period of time and is still requiring restrictions now, one really important thing is to ensure that staff have food and other treats. So I'm now going to thank all the people who have made it possible for food to be delivered to the hospital and indeed for various treats to be provided. So I would like to thank Meals for NHS, the Home Community Cafe and Family Meal for donating literally thousands of meals during the lockdown period for our very hard-working staff. I know these meals were all much appreciated, so thank you so much for that. Now, in terms of treats, a number of different people and groups have donated things like chocolates and Easter eggs. And I'm going to thank some now, but there may be others who've donated, and if I don't mention you specifically, still our warm thanks go to you. So I'd like to particularly thank the Fowry family, who, as well as donating chocolates, donated a very generous sum of money through their online fundraising. I'd like to thank the Don's Local Action Group, the Old Rutlishians, and Eddie Jackson for your many donations of Easter eggs, which were particularly appreciated, of course, around Easter time. Changing the subject, another initiative that we've run during the COVID period is an initiative we called Stay Connected, which was to help patients and their relatives connect with each other electronically when it wasn't possible to visit the hospital using devices such as iPads and tablets. And with our Stay Connected appeal, a number of people and community groups have donated tablets and other devices to help maintain that communication between families and their loved ones. So thank you so much for those donations. Now, one of the things that went on in the hospital during the lockdown, so obviously without large crowds to watch it, but no less important, was our patient corridor challenge, where we had 4 patients, Bernadette, David, Graham and Nicole, patients of our brain injury service, who set themselves the challenge of walking the full length of the hospital main corridor. And in doing that, they raised nearly £10,000 worth of sponsorship and, of course, with great determination and motivation, successfully completed that patient corridor challenge. So well done to the 4 of you for completing the challenge and also for raising nearly £10,000 for the hospital. Next, I would like to say that music has always been a really important part of life at the RHN. And of course, we have our own fabulous music therapists working here. And in this section, I would like to particularly thank Joe and Bethy Reeds, and indeed other volunteer musicians who work with them, who put together 2 fundraising events by holding a virtual piano-thon and also an event which was a day at the movies, and indeed by holding various other events. These have all been really important in terms of supporting the hospital for raising funds, so thank you so much. Now, in terms of overall fundraising, this has all been contributing towards our COVID emergency appeal. I have to say this year has been a difficult year for fundraising in general, for some various obvious reasons, like lots of major events being cancelled and so on and so forth. But our emergency appeal has been very successful, and it's only been successful because of the enormous support that all of you watching this video have given us. And to date, our emergency appeal has raised £167,000, which is a fantastic contribution to supporting the extra costs that are essential to keep our patients protected and safe during this very difficult time of the COVID crisis. So thank you so much for those of you who have contributed to that emergency appeal. And then, really to wrap up, I'm sure there are many people that I haven't mentioned by name, and if I haven't mentioned you, then I apologise for that, but we really are grateful for everything that such a wide range of people, some closely connected to the hospital, some maybe more aware of us in the general community, that you've done to support us. The hospital does remain in good shape. We remain confident about the future. We want to work with all of you who support us going forward to continue to help the hospital thrive. And indeed, I look forward to the day when we can all meet again in person. Hopefully this time next year, we will be able to hold an in-person thank you evening. Who knows? There's quite a lot of uncertainty in terms of how COVID is going to continue over the coming months. But please rest assured, we're here. We continue to look after our patients and residents. We continue to want to work with you, and really we thank you so much for your support. And best wishes to you all, because of course you all have to deal with your own versions of the COVID crisis and how that affects your families as well. So very best wishes for the future, and I look forward to seeing you all here at some time in the future. Thank you very much.